we spoke about DVT, which is deep vein thrombosis. So we'll be moving on to like a brother of DVT. So this is what is known as what? Disseminated Intravascular Coagulation. This is DIC rather. Alright, so DVT, we said that there's abnormal clotting in deep veins. Okay, so how about this one? It's a serious and complex condition. This is where the body's clotting system goes haywire, like it's not controlled again. Alright, so clots are formed throughout bloodstream, then paradoxically leading to excessive bleeding. Like, two things are happening: clot formation coming in, after clot formation bleeding comes in. Do you understand? So it's not a disease on its own, right? It's a complication of what? The chief disease. Like, if you sit in a patient, you can be suspecting things like sepsis, trauma, cancer, maybe obstetric emergencies, So what usually happens in DIC? Alright, so there are two phases. So first of all, there are so many clots, right? So these clots can block blood vessels. This will now block how blood is reaching the organs. Do you understand? Then next, the body runs out of platelets that should form the clots or clotting factors. Now this will now lead to bleeding. Do you understand? The body overworks the platelet, uses them up, overworks the clotting factors, uses them up. Then next is bleeding. So symptoms is such a person is bleeding from the gums, from the nose, internally too. Alright, there's bruising or petechiae, that's tiny red spots, organ dysfunction, shock or low blood pressure in severe cases. Alright, so this is like the pathogenesis. Please, you can pause to look at it. Alright, so causes, if you see it, then you can be suspecting things like sepsis, maybe there was a major trauma, cancer, especially leukemia, pregnancy complications, snake venoms, transfusion reactions, liver failure. So diagnosis, you are just doing all those blood tests to measure platelets, measure your clotting factors, check how long it took blood to clot, and all of that. So treatment is platelet transfusions, because platelets are lacking in such a person, fresh frozen plasma, cryoprecipitate for fibrinogen. Heparin may be used in chronic DIC with clotting, but not in acute bleedings. Okay, so that's just what the disseminated intravascular coagulation simply means.